Hey followers, this is your boy, movie maker Doug 55. I'm the author of Ray Guns a Chronos, War on Claudiusville, Part 1, The New Heroes. And today, Andy and I are doing another episode about mental health during times as COVID. And our guest today is Melissa Mel Yu. Welcome, Melissa.
Thanks so much for having me. Very excited to be here.
Hi Mel, how you doing?
I'm good.
Mel's in Melbourne, Australia. I'm in Studio City. Doug is in Phoenix, Arizona. And those of you who've been watching the series, you would have seen Mel's other episodes where she was sharing her life journey. The whole purpose of today is Mel is going to share with us what's going on in Melbourne, because Melbourne seems to be the place in the world at the moment where it's just continually in lockdown. I think it's getting better, Mel, right? But it's just lockdown, you know?
That's it. So basically, for those that don't know, right now in Melbourne, Australia, we're the only state in Australia that's in a stage 4 lockdown. So how our stages work is 1, 2, 3, and 4 is the worst so far. And what a day like this looks like, we are coming up to 7 weeks of curfews. We had a curfew from 6 a.m. to 5 a.m. till 8 p.m. at night. And then from 8 p.m. you basically have to be inside your house and not out at all, or not traveling. During the day, we are allowed out 1 hour for exercise. And then you're expected to be home unless you're an essential worker. Even if you are an essential worker, every single Victorian has to carry a worker's permit so that it gives you permission to travel. So at any point, a police can stop us on public transport, along the roads, or in your vehicle, and you have to produce this worker's permit to be able to be accessed on the road. So what Melbourne City looks like, I live in the city, it is quiet and it is eerie. It's
so what's the consequences if you get, caught outside the curfew by the police or transit officers?
So it's a $1,600 fine for personal. And if you don't have a face mask, so face masks for us are a mandatory law now as well, because we're in a state of emergency. And that's a $200 on the spot fine as well. If you're not
Jeez, it's not like that. In LA here, yes, everyone's wearing masks. Everyone's pretty good with it now. But everything's open here. When I say restaurants outside on the footpaths or in the parking lots, I don't know whether that's a good thing. I think it's great for the businesses, but I don't know whether it's curbing the COVID.
Well, they say because it's outside, it can it's less community transmissions. Yeah. We aren't open, so retail is closed, hospitality is closed, like a lot of gyms are still closed, public parks are closed, playgrounds, everything is still quite shut off. Wow. We are looking back to easing at the end of September this month and at the start of October, but that's all based on cases. We need to have only 5 new cases a day to be able to then slowly open back up. In Australia, we have started talking about how does hospitality come back in, and we are looking at that New York model or the American model where we do outdoor dining. But the reality is, for Melbourne, we don't have that same culture and community as the States. We can't just do outdoor dining. We don't have the infrastructure to do that. We don't have the roads to sort of offer that, and we don't have the weather. Yeah.
It's it must be the compounding effects on businesses must be enormous. Like, I don't know what is the government doing there for, like, just starting at businesses, helping businesses there? Because I'm sure a lot of them have gone to the wall. Like, they would have had to.
So you definitely, I can even send you guys photos, or just do a quick Google search. The amount of retail stores that are for lease now, it's everywhere. In the city, the amount of shops that have had to close up, businesses haven't been able to survive. Wow. Especially mum and pop businesses that are those small businesses that really needed foot traffic. Think about a city that's completely gone into shutdown. More than 90% of those are cafes that bank on people coming into work. With everyone working from home, there's been no foot traffic, there's been no orders, they've lost that morning rush of coffee and the afternoon rush of coffee sales. Everything's just, it's been so hard to survive. So I think coming out of this, the new normal will be looking at some of the businesses that have been able to pivot and innovate and go online, they might be able to get that back up. But I think a lot of them will turn into just those retail giants or corporate hospitality things that have the money to survive this pandemic.
Yeah. Wow.
So it'll be very interesting to see what happens on the other side.
Yeah. And what's the stress levels like I'm sure they're like in every country in the world, there's lots of anxiety and stress, but we're just talking about Melbourne at the moment. What are the stats on stress levels and mental health issues at the moment?
Yeah, so we've noticed in terms of the mental health, we've noticed an extreme spike between like March, April and May this year in phone calls for crisis phone calls at Lifeline Australia, which is our national crisis hotline, compared to last year. And in terms of mental health, I think people need to recognize that right now with this pandemic, people have an extra layer of stress that isn't even ours. It's the energy that's happening around here. Like physically, I think Victorians are feeling an additional layer of this uncertainty that's happening right now. And if you don't have the awareness, if you already have a natural tendency to lean into things like depression and anxiety and stress, if you haven't managed that internal world, then you're feeling that extra layer of every single person around you. Even to the point now, we can't even see someone that is smiling because you can't really, everyone's got a mask on out in public.
Yeah.
And so we're losing a lot of that, what keeps us kind and what keeps us connected. Being isolated at home and only allowing the 1 hour of exercise, which is now, thank gosh, opened up to 2 hours of exercise for the next 2 weeks. So we're allowed, we get an extra hour of playtime. But that whole transition has really added just a whole level of uncertainty into what we once knew and what we were once comfortable with. It's about adapting to, okay, well, how can we stay social? How can we stay connected in a world that is vastly changing? Our premier here, Daniel Andrews, is releasing such inconsistent information about government grants, government supports. So going back to one of the questions that you had asked, what is the government doing to manage this sort of stress and anxiety? Well, for businesses, they've been given a $5,000 grant. But think about that in the scheme of things. What is $5,000 actually going to do for a business to open up? That's one day, not even a day's taking.
No.
Yeah.
And
that's really tough what you guys are going through. And I must be honest, last year in December of 2019, I think today that there's a chance that I might have actually had a case of COVID. Last December, I went to Carlsbad Caverns. I don't know if you saw my Facebook, but Andy probably saw. But I went to Carlsbad Caverns, which is in New Mexico. It's the largest system of caverns in America, and it's a national park. During the trip, I got sick. I had bloody, and I had congestion. And I also coughed a lot. And it actually felt a little bit different from normal flus that I've gotten. And so I really think it could have been COVID. But I was given medicine by a flight attendant. And as a result, I recovered. And I haven't gotten sick ever since then.
And no one knows, but if you recovered that quickly, it probably wasn't COVID. Or it might have been a mild dose of it, but I think if it was COVID, you would have been way sicker than that.
Probably.
But,
I think it's so interesting now, though, because when someone coughs, everyone looks over and goes, it's COVID. But people still cough, and the flu still exists, and our immune systems are still immune systems. But I think now, because of the amount of focus and attention that is being brought on COVID-19, everyone is just looking at someone that's even got like a slight sniffles, and we're like, you should go get tested. You have coronavirus.
Yeah. Hey, that's something else, Mel, I was going to ask you. Someone mentioned to me the other day about, and this is just a passing general comment about people's general immune system, because you're not mixing with people for the last, not as much as we normally do out in the open, mixing with people and germs. So the human immune system is probably not going to be quite as strong when people get back out, and even just general colds or the flu could then have a bigger effect on people than what it used to have, And I don't know if that's a medical fact, but I thought, well, there's a bit of bit of common sense behind that, because we're not out. The immune system only gets strong when we're out in that environment.
Contact with germs and things like that. Exactly. In terms of the suicide rates have not actually risen, but we don't know whether the correlation between suicide and the impacts of COVID. On top of that, it'll be interesting to see how the next 3 to 5 years does look like in terms of those rates, because people are going to be feeling this effect long after the lockdowns have eased.
I think it's going to be interesting all around the world.
Correct.
Where, you know, once this starts to go away or they get the vaccination, I don't think any of us really at this point know what's going to happen, you know, like how long we're going to be wearing masks. Do we still have to keep cleaning our hands? And I mean, these are obvious questions. People go, oh, yeah, you do. Well, I guess, but we don't know how long and what sort of effect is that having on us. We want this to go away, but it's so normal now to wear a mask. I don't like it. I don't like feeling normal wearing a mask, but I know I have to do it and I will. But it's that weird feeling of like, oh, I'm getting dressed, got my, you know, got everything on.
I have my mask.
Got my mask, you know, got my hand sanitizer.
100%.
So Mel, go on.
No, just to add to that, the interesting thing, I suppose, is how you're going to be able to help your own mental well-being is not be too tied into what once was. Because the reality is that we have entered a pandemic, we have entered COVID-19, we are now moving out of this, it's a new normal. So to have those expectations of what once was and the happier days and life was shinier in the past, that's going to give you a lot of feelings of nostalgia that might not necessarily serve you. And that's where depression's going to start to lie and form, because depression is when you start looking back at the past and focusing on the past, you're not actually living in the present. And so to sort of relieve some of that and just like find that acceptance that it's like, I don't like this, I don't feel like it's in control. However, this is my reality. And that's going to give you a little bit more peace and calm and clarity moving into that new normal.
And I can sit here and go, hey, look, everything's going to go back to life. But I don't know that. But we're pretty sure with human history that all the pandemics that have happened, life does go back to what it is. It's just the human body has got to adapt to this new bug that's been released accidentally, so they say. We hope. We've just got to adapt to it because the human body's strong. Once it adapts, we're just going to keep going until something else occurs, you know? So one question, Mel, is what in your world of working with mental health, what are some of the things that people are being offered to help them? Like I talk to people all day coaching and they just got no motivation. So I'm like, I'm locked in my house and I really get it. So what can you offer for people to keep this healthy and keep yourself motivated, even if you can only go out for 2 hours a day?
100%. So one government initiative that's specific for Melbourne Victorians that I did want to highlight is the government did add on. So we have a thing called a mental health care plan that is a government subsidy that we can access for free every year, 10 sessions. They actually increased that now to 20 sessions because they are highlighting that, okay, mental health is deteriorating. So now every Victorian should they wish to, access 20 free bulk billed Medicare mental health sessions with a psychologist.
That's good.
If all around the world, though, you don't get such luxuries and privileges to have that access and you are in an isolated space, how can you look after your mental well-being? So that comes down to, what are your morning rituals? What are things that you can put in place in the morning to set your day up so that you do feel like you can achieve something? So a easy everyday tip for me is make your bed. I don't know if people live by this, but I adopt it and I notice a huge difference. Every morning, you can see just here, I'm sitting on my bed. My bed actually is always made. The pillows get propped up. And that little gesture for me goes, okay, I'm ready to show up in the day now and I've achieved one task. If the most that you can achieve within your home is make your bed and potentially shower and get up and eat, that's a positive thing. And let's celebrate those little wins in a time like now where everything kind of feels like a struggle. So if you're able to do that, you'll declutter your space and then you'll be able to show up. If you're working from home, A good tip for me in terms of working from home is set up that corner or set up a desk, even if it's a makeshift office. Get out of your bedroom or like your bed, because working from your bed and then watching a movie in bed and then going to sleep in bed, you're not really maximizing just the space that you're in. So if you can shift that energy and that space, physical location, even if it's on a dining table, set something up that has structure and organization. Because what we're missing out on now, when you did used to go to work and have a desk, well, you're working from home. So you have to almost create that space in your home now. And so you can associate it with work, and that's going to maximize productivity.
That's right. Eating place, sleeping place, you know, lawn, all that stuff. And I think too, from what I've been talking to a lot of people is like, if the weather's okay, because Melbourne was just coming out of winter, like you got a front and backyard, most people have, even if you live in an apartment, you still got a space you can go out. And just go out, like just to go out and get the sunshine on your body, even if it's a bit cold. Who cares? Now you should embrace the cold, because now, you know, you're not allowed out. So I want to go out and feel what the cold's like now, you know?
Yeah.
And I think just get out in the weather a bit and just, it's not easy, but it's one of those things, like you said, you've just got to have little habits through the day. And it's a perfect time to declutter, perfect time to start putting things up and get rid of that and put it outside. And when time comes, you can throw it out or chuck it in the garbage, you know. But this is, I think, the perfect time to clean things up.
Can I add something very quick?
Yeah.
Hey, Mel, did you see my statement that I gave on mental health the other day?
You post a lot. I don't know if I saw the specific one. Maybe.
Yeah, one of the things that I definitely think needs to be different in times as these is I definitely think that mental health culture needs to change. And what I mean by that is one of the reasons that people commit suicide is not just that they're in a bad space in their life. It's because they don't think people care. You know, that's one of the things that contributes to suicide, is the idea that nobody cares that you're not in a good place. A few years back, when I was in a rough spot in my life, and this is something I said in the statement, I had reached out to former schoolmates of mine that kind of dropped me due to circumstances. And I asked them for advice because they were successful students, you know, and I wasn't in a good place. And they didn't respond. And I don't know if it's because they didn't have respect for me anymore, or if it was because they didn't have advice for me. But, you know, the thing is, when someone is not in a good place in your personal life, you know, you don't need to be a professor to you know, you don't need to be a professor to help them. All you need to do is words of encouragement. You never know if all they need to avoid committing suicide are just nice words of encouragement. You know what I mean?
100%. And active listening, the power of just being able to share and listen, that space, that's what talk therapy is all about. It's being able to have a safe space where someone can hold you and talk about all of this stuff without judgment. And I think that's really going to help with your mental well-being. Find those people that you can lean into. And if you don't feel like you have anyone that you can trust, call a hotline. In every single country, there is free counseling services because of this. There is someone out there that wants to listen and that is happy to hold you in that space. So
yeah, and that's what that Are You OK Day is about as well, right?
Absolutely.
It's
and literally,
I don't think we got anything like that in America. I mean, they've obviously got helplines, but I don't think they have something similar to Are You OK Day. I know they have a lot of other things in place, but it'd be great to have in times like this just something a little bit more, you know, available for people to, you know, call up when they're not dealing with things, you know. Hey, sorry, Doug, were you going to say something?
Yeah. And literally one of the guests that we had on a previous episode, Tyson Jarvis, he told me that when he began studying under Andy, just like me and Andy when I started, the first thing that Andy asked him was, "What's wrong?" And Tyson was like, you know, he was like, "Nothing." And Andy was like, "You're not going to get better until you tell me what's wrong." And when I started training under Andy in either 2015 or 16, it was one of those years, I asked Andy the same thing, and he told me, and he asked me the same thing. And when I told him nothing, Andy was like, "You're never going to feel better until you get it off your chest."
I love that.
And what Doug was sharing was like, and that's what you just said, Mel, is being aware. Like, I didn't say I was going to cure them. I just said something's not right. And for us to work in this space, we've got to work out what's going on here, because there's a weird energy coming from you, and I'm not saying it's bad or wrong. And then when Tyson opened up, he was going through a really bad spot in his life. And, but he turned that around, and he only messaged us the other day, and he said, COVID just took everything away for a little bit, just a few weeks. Like, he started eating wrong and he wasn't training as hard. And then he thought, what am I doing? What am I doing? I didn't work this hard for 3 years to get there. So he just started eating properly again and training hard and getting out when he could. And it changed everything. It sort of transformed his mindset again. So,
and I think what you do so well, Andy, is that it's the ability to go layers deeper. So when people go, how are you? It's same as Are You Okay Day campaign. That's the surface level. And if someone goes, yeah, I'm fine, your ability to be that person and go, tell me like what else is up, because I don't feel you're saying you're fine, but you're not presenting fine. There's an energy about you that's not fine. I can see that there's things going on in your mind. So that ability to dig deeper, when you can go 3 layers deeper, that's when you're actually starting to get to the core of the problem.
Yeah, 100%.
Shrek says, onions have layers. Ogres have layers.
I think there's an ogre behind you. I don't know if you know, but there's a dark shadow behind you, and I don't know who it is. I don't want to know who it is.
I've been noticing it too. I've been seeing it too.
Yeah, it's almost dark where I am, so maybe it's time we concluded soon.
Well, yeah, we'll have to anyway. We've run out of time. But look, that's really great, Mel, what you shared. And this is not, we're obviously adding disclaimers here. We're not saying to people, go do this, you'll feel better. It's just sharing what's going on. And really the bottom line is, if you need help, then you need to get help. You need to go ask for help. One of the most powerful things that I think sometimes people miss is groups. Like, this is the most perfect time to form groups, whether it's close friends on Zoom or Facebook or FaceTime, family members. I've got all my family, every living family member is on a Zoom meeting we have once every 2 weeks. And we text every now and again. I'm in LA, they're in Australia. Just when I go to bed, I say, good night, everyone. And then you get someone say good night. But it's getting that group together. When you have a group, you've got more power because you support each other, and I think a lot more people are doing that. But I think if you're struggling, look for friends to, join up a little group, a COVID group,
Absolutely.
Yeah.
Well, Doug, and Mel, just like to thank you again for making time, because I know you're starting to get busy and geared up now that Melbourne's starting to free up a bit. So thanks for making the time, and thanks, Doug, for inviting Mel again onto the series.
No problem.
Yeah.
I want to thank both of you guys for joining me on my YouTube channel. I enjoy every bit of it. I enjoy Andy's beard. I enjoy Mel's beauty. Yep. And I also want to say, whenever you guys have a chance, check out my screenplay, Ray Guns a Kronos, War on Claudiusville, Part 1, The New Heroes.
Hey, Doug, before you go, what's the other book you've got, the one that's best-selling on Amazon at the moment?
And also, please check out my other book, From Green Flags to Blue Flags 2, The Amazing Comeback of an Autistic Spokesperson.
And just to add on that, Doug found out yesterday that book is now used in a curriculum in a school in Idaho.
Yep.
That's amazing.
My
Which is amazing.
Karen Glassman told me, and she's the mother of Andy's former client, Cassidy Glassman.
Yeah, so that's excellent. Doug's book is making its way into educational institution. Well, thanks, Melly, and I hope to see you soon.
Yeah, we'll see you soon. Stay connected, stay safe, and be well.
Yeah, you too, mate. Thank you.
We'll keep doing these in the future.
Thanks, Dougie.
Thank you.
Mate.